this video, we're going to go over manual therapy techniques to try to improve AA mobility. So we're going to start with some more basic and general techniques, and then we'll kind of get a little more specific as we move on. The initial one here, you're going to take the head into full side bend, lift the shoulder, take a little bit of tension off the upper traps here, and you're going to bring the cervical spine into rotation contralaterally. Once you get to that end range position, you can do just an oscillatory or sustained mobilization. And the key in this position is getting the head to full side bend end range first, so that when you rotate contralaterally, the motion is primarily just coming from the AA joint. Now make sure that you maintain that full end range side bend during the technique, and you don't let the head roll out of it like that. It's almost as if your axis for which you're doing the rotation changes. So as you follow the head into full side bend, then you want to rotate as if where his head is your new axis, like that. So I can do that oscillatory or sustained mobilization, or a muscle energy technique. So we're going to do direct or indirect. Go ahead and bring your head to the left, Jim. Rotate left and relax. And again. And relax. And let's do one direct, so go ahead and rotate right. And relax, good. So that's a mobilization and muscle energy technique that we can use to treat the AA joint. Now if we want to try and manipulate it, you can get the head into the same end range position and add just a quick little thrust. So I'll get there. My hands are just grasping the occiput, and then fingers are holding on to C1 a little bit as well. And get to that end range. And that feel okay there, Jim? Good. And then just a quick little thrust. All right. An alternative adjustment that I like is I will bring the upper cervical spine into slight extension, a little bit of side bend, and then more rotation like that. So it looks very similar to the technique we just did, except we're not quite side bending the cervical spine completely like we were before, and we're adding an extension bias to it as well, like that. So once you get to that same technique, or that same position, you do just the same exact technique with a quick little rotation thrust at that top point. So the difference is, again, extension, little side bend, and then rotate, as opposed to the first technique we went over is full side bend, no extension or flexion bias, and just rotation. Now these are excellent techniques for just improving general AA mobility, and typically speak more towards a latexion restriction. So that would be where your C1 inferior condyle is not moving anteriorly relative to C2. In the instance where you want to try and get a little more specific with that same sort of technique, you can place your second MCP right at your posterior C1, and you're going to add just a little bit of a side bend. So I'm going to treat now on this right side, trying to improve it into latexion. So I'm going to provide a little side bend at that spot with a slight posterior to anterior glide as well. So this is going to feel a little bit more like one of your typicals type of mobilization. Now if you want to try and treat a rotection restriction, which those other techniques that we've covered already did not directly address that, you can try and address a rotection restriction through a latexion technique. However, it's not quite as specific. So I'm going to have Jim lay on his right side. And I'm going to support his head there again on my hand, kind of like we did for our OA treatment technique. And then my thumb is going to be on the posterior C2 spinous process, or transverse process. Now I'm just simply going to block and add a counter rotation with my thumb, trying to rotate C2 towards the right. And with my right hand, I'm just adding a slight side bend and lift like that, almost rotating his head to the left. The key here that I see people messing up on is that you want to make sure your thumb is lateral enough to be on that transverse process posteriorly for C2, people tend to get a little bit closer to the articular pillar instead. And this one I'll do a slight sustain hold with it and kind of rotate around. Another important concept for this is make sure you've gathered up enough soft tissue for the technique, otherwise it can get a little bit uncomfortable. Now this technique that I'm doing as we speak, I'm trying to improve left cervical rotation because I'm blocking C2 and trying to bring C1 into that left rotation. So here we have a bunch of different techniques for trying to address the cervical spine at the AA joint. If you want to be a little bit more general, you can try some of those first techniques where you're working on that primarily that side bend counter rotation type of technique, whether it be thrust, whether it be mobilization, whether it be muscle energy technique. If you're trying to get a little bit more specific into rotection and latection, you want to try these secondary techniques that we just went over, which are just mobilizations.